So let's talk briefly about the incision for breast augmentation. Again, I've been doing breast augmentations for over 25 years, and I am a very big fan. I'm actually a pioneer of the underarm approach, meaning the incisions in the axilla, in the armpit. Depending on the kind of implant, the incision might be 3/4 of an inch for a traditional saline, and up to about 1.5 inches or so for a silicone or ideal implant. The reason in favor of the underarm approach is really, really simple, and that is, what woman wants a scar in her breast as part of making the breast more beautiful? I don't think a scar in the breast makes any breast more beautiful. Now, of course, if a woman has a breast with some degree of a sag and a fold, putting that scar in the fold for many people is no big deal at all, and there's nothing wrong with that. In fact, the scar under the breast gives us the easiest approach to do the operation. However, I've been doing the underarm approach for a good 25 years. When I do it, it is not a blind procedure. I am using an endoscope. That means it's a metal tube attached to a camera head, and I am seeing what I am doing on a TV monitor magnified with great clarity. So if anything, I see at least as well as if I were going under the breast. And what I'm succeeding in doing is taking the scar from the very special area of the breast and putting it in an area that is not so special, which is a crease in the armpit. And in fact, after several months, in most cases, that scar is invisible. Now, what must be understood is the underarm scar, you can't do every reoperation through the underarm. So if you elect to get a silicone gel implant through the underarm and it ruptures, for example, or if it gets a severe contracture, I won't be able to fix it through the underarm. I'll need a scar under the breast. If you get a saline implant, including an ideal implant through the underarm, and that ruptures, I will be able to replace it through the underarm. Something interesting I've been doing for a few years now is giving Botox, botulinum toxin, to the underarm a couple weeks before the operation, and that is in order to reduce the bacterial counts in the underarm and make it equal to the rest of the skin on the body, because when you stop the sweat, you stop the bacteria, the special bacteria that are in the underarm that give you a smelly armpit. So we've been doing that for a while, and I think the underarm approach is a tremendous approach. It's very interesting that here in the New York area, there's almost nobody that's experienced with the underarm approach. If you go to Asia, where scars can tend to be darker, more angry looking, it is a very common approach, and I think it's a very important option for women to understand, for women that are self-conscious and simply don't want to have a pink or white or dark scar, which is particularly a risky proposition if you have pigmented skin like Asian skin or Latin skin. But again, I've had plenty of Caucasian, very white women that just don't want that pink scar under the breast, so it's important to note you do have the underarm as a choice, which comes with equal precision when you have someone experienced doing the procedure.